As a country, we spend over £4 billion every year looking after 75,000 children in our care. Despite the levels of that spend, the sector doesn't know what impact this actually has for children and young people. IMPOWER's EdgeWork methodology has enabled us to reframe both the problem and the ambition, and to create an innovative programme of work we call Valuing Care.
The biggest key challenges we have in terms of achieving better outcomes for looked after children is by far placement stability.
The other challenge is that we want to have a narrative that care is good, so that when we are looking after children, we can be able to explain not only is the money spent well, but actually the current experience for children in our care is a good experience.
Valuing Care is a way of working that we've developed with 5 councils to create a framework for a common language and a common conversation, really rooted in the needs of those children. So the 5 authorities involved in Valuing Care really want to be able to show what difference are they making, which ultimately will cost less too.
What Valuing Care has provided us with is an opportunity to help our social workers particularly, as well as managers, think differently about the care that they're seeking.
What we've done in Hertfordshire is we've identified a set of outcome domains. So we have 6 outcome domains, and what we're doing is we are needs profiling in each of those domains, and we're able to develop a care package and a support plan so that we reduce those needs for the children.
We've been profiling children who are in residential placements over the last 6 months, and we've been able to step down 5 children into foster placements where we've identified that their needs are such that they don't need the intensity of care afforded to them in residential.
Well, we had one young man who was in a residential unit, and we were really concerned about missing episodes and exploitation from a gang. Throughout the period he's been in this new placement, we've constantly looked at our radar chart to look at our outcomes. And I could really map where his missing episodes had declined. There was no longer a worry about exploitation from a gang. And it was really easy to do that through the chart and to demonstrate that to everybody.
Valuing Care is an approach that's really shifting the culture across Hertfordshire. And we are now delivering much more personalised assessments and much more personalised packages of care.
What I'd like to think it is doing in terms of improving the quality of care is that we're matching children better, therefore by its very nature the experience is better and they'll be able to settle much more quickly.
A year and a half ago, if you asked Oxfordshire, what are your needs, what are the needs of your children, we wouldn't have been able to tell them. But now we have a really clear picture and we have a really clear story to tell. So far, the Step Down project has made savings to the local authority of around 475,000 over the last 6 months.
I think what's been really great about IMPOWER is that they really understand what it feels like to be on the front line of practice.
They're connecting us with our colleagues, so we're all speaking common languages. I think that really helps providers as well, so we all know that we're talking about the same things for our children.
Seeing them come in, they're talking to frontline teams and team managers, and they're actively encouraging us to be involved in the project, which I've found really empowering as a team manager.
It's an approach that can be carried across all sorts of domains within social work.